Causes of erectile dysfunction and sterility in male. Psychological. Earlier psychogenic causes were supposed to be the most common cause of erectile dysfunction, but recently organic disease causes are found to be the most common. Absence of a desire for a sexual intercourse may result from a dislike of partner, fear of failure, anxiety or mood disorder, guilt and aversion. Low self-esteem, hypochondriacs, childhood abuse, sexual abuse, masturbatory anxiety, Dahat syndrome, passage of whitish discharge in urine, and believed to be semen. Widower syndrome, post-traumatic stress disorder, excessive masturbation may also lead to erectile dysfunction. Age. Before puberty, boys are usually impotent and sterile when certain exceptions like precocious puberty. Poor physical development of penis is most common cause of erectile dysfunction. Examination depends more on its development than the age. In advanced age, libido diminishes, but they are not impotent or sterile. As long as live spermatozoa are present in seminal fluid and individual is presumed to be fertile. Developmental and acquired abnormalities, absence of penis, intersexuality malformation, hypospadias, epispadia, absence of testicles, Klinefelter syndrome, retrograde ejaculation and cryptorchidism, local diseases, priapism, hydrocele, elephantiasis, phimosis, peyronie's disease, adherent prepuce, orchitis following mumps, syphilis and tuberculosis. Mumps can cause sterility, not erectile dysfunction. Exposure to X-rays may cause sterility. General disease. Erectile dysfunction is common during acute illness and in severe and debilitating illness. Neurological conditions like tabes dorsalis, multiple sclerosis, paraplegia, hemiplegia, syringomelia, temporal lobe damage and third ventricle tumor, endocrine disorders, diabetes, hypothyroidism, hyperprolactinemia, testicular atrophy following renal failure, hemochromatosis, cirrhosis, blood vessels and nerve trauma, long distance riding, bicycle riding, serious disorders, Derrick syndrome and diseases like tuberculosis and nephritis may cause erectile dysfunction and stability. Malnutrition, vitamin C, vitamin zinc deficiency may cause erectile dysfunction. Injuries, infertility is a significant problem after spinal cord injury. Two major causes are poor semen quality and ejaculatory dysfunction. Ejaculatory dysfunction may occur following treatment for a lower limb fracture due to perineal neurovascular traction injury occurred during surgery. Fracture of penis, rupture of both the corpora cavernosa with a urethral rupture may result in erectile dysfunction. The commonest cause of fracture of penis are coitus and penile manipulation, especially masturbation. Chronic poisoning, exposure to poisons, lead, arsenic, pesticide, aphrodisiac agent may lead to erectile dysfunction or sterility. Medication, antidepressants, selective serotonin reuptake inhibitor, antipsychotics, antihypertensive, anti-ulcer agents, cimetidine, cholesterol-lowering agents, and finasteride may cause erectile dysfunction. Behavioral factors, lifestyle choices, chronic alcoholism, smoking, being overweight, and avoiding exercise are possible causes of erectile dysfunction. Tight-fitting underwear causes increase in scrotal temperature that may result in decreased sperm count. Addiction. Certain drugs, morphine, heroin, opium, cannabis, cocaine, and tobacco smoking may cause erectile dysfunction, sometimes sterility. Penile erection is a complex process involving psychogenic and hormonal input and a neurovascular, noradrenergic, non-cholinergic mechanism. Nitric oxide is considered as the main vasoactive neurotransmitter and chemical mediator of penile erection. Included nitric oxide bioactivity is a major pathogenic mechanism of erectile dysfunction. Treatment of erectile dysfunction often requires combination of psychogenic and medical therapy. Oral phosphodiesterone type PDF inhibitors are useful in this respect. Causes of erectile dysfunction: congenital, local disease and age. Congenital anomalies: penile, hypospadia, epispadia, non-development of penis, maldevelopment of penis, hermaphroditism, Peorin disease, micropenis. Hypospadia, urethral opening, penis scrotum, cryptorchidism, hydrocele, phimosis. Then testicular absence of both testes, cryptorchidism, undescended testicles, pseudohermaphroditism, Klinefelter syndrome. Local disease causes penile, phimosis, paraphimosis, ulcer on penis due to syphilis or tuberculosis, malignancy, elephantiasis, adherent prepuce balanitis, testicular local disease affecting testicles, epididymis, elephantiasis, large hydrocele, scrotal hernia, acute or chronic inflammation of the testis, atrophy of testis, malignancy. Traumatical or surgical accident, injury to testicle resulting in a hematocele, blows on head or spine at level of lumbar, 4 or 5 vertebra, previous surgeries like abdominoperineal resection, radiation therapy and surgeries done for malignancies, constitutional and hormonal disease, acute illness, fever, endocrine disorder, sexual infantilism, major and chronic disease such as diabetes mellitus, hypertension, atherosclerosis, pulmonary tuberculosis, hyperlipidemia, Addison's disease, hypopituitarism, thyrotoxicosis, uremia, mixed edema, paraplegia, hemiplegia, hyperprolactinemia, syringomyelia, tabes dorsalis, transverse myelitis, schizophrenia, bipolar disorder. Neurological, traumatic or brain or spine, Parkinsonism, Alzheimer's disease, cardiovascular diseases, multiple sclerosis, brain tumor, peripheral neuropathy, diabetic, Coda equina intra and pelvic and pudendal nerve lesion due to pelvic surgery, tumor of spine involving lumbar segment, overindulgence of habit-forming drugs, barbiturate, alcohol, opium, cannabis, cocaine, heroin, LSD, tobacco smoking, medicinal drug, beta blocker, digoxin, clonidine, imperial dopa, luteinizing hormone, releasing hormone, LSRH, analog antidepressant, selective serotonin reuptake inhibitors, cycle, H2 receptor antagonist, imitating ranitidine, spironolactone, chemotherapy, hormonal medication, age. Erectile dysfunction is usually observed at the extremes of age. Psychological. Temporarily, erectile dysfunction may result from absence of a desire, fear, guilt, anxiety, hypochondriasis, timidity, aversion, fear of inability to complete the act, especially when the opposite partner is very virile. Sexual overindulgence may result in premature ejaculation or temporary erectile dysfunction. Thank you.